Ladies and gentlemen, welcome to this new episode of our program Bosom Sao. Bosom Sao is a health program that is brought to you by Crest Natural Health Center, or commonly known as Edward Yabakade. At Crest Natural Health Center, we are specialists in treating the diseases that affect mainly the elderly. These are senior citizens from the age of 45, 50, 60, and above. And we are specialized in the following these conditions. Number one, treating enlarged prostate. These condition affect the elderly from the age of 45 years and above. We treat heart problems, especially the condition that affects the elderly. Number three, we treat the condition of the spine, affecting the spine and the joint pain, especially problems affecting the back, problems affecting the knees, problems affecting all the joints in the body. And this is a condition that affects the elderly more. So I'm Dr. George Lutrama, the host, who's going to take you through this program of Bosom Sao. Today we are going to be looking at the symptoms that affects the prostate gland. Previously, we've been having series of programs when we've been discussing many different things concerning the prostate. And let me take you to our previous program. In our previous program, we looked at the conditions or diseases that affects the prostate. In that program, we summarized them into three. Number one, there is the prostatitis, which is an infection that affects the prostate, and mainly it's caused by bacteria, which can be treated very well. Number two, this benign prostatic hyperplasia or enlargement of the prostate, which is not cancerous. This one affects the elderly, the senior citizen. Number three, there is what we call cancer, or prostate cancer, or prostate carcinoma, prostate malignancy. All these one means cancer. So those are the three diseases that affects the elderly people. And today we are going to be looking at the symptoms of the enlarged prostate. You men, when you are here, I said earlier that this condition affects the elderly, especially from the age of 45 years and above, and does not affect. And one of the people that is not isolated, even the women, because this is your father, this is your husband, this is your uncle, this is your neighbor. We are all involved in this in this problem of the prostate. So there are many symptoms that affects the prostate, and one of those symptoms, the chief symptom that affects the elderly, is frequent urination at night. The frequent urination at night. What do I mean? You wake up in the middle of the night, you pass. Towards the morning, you pass urine 5 times, 6 times, 9 times. And the last person I saw was urinating 28 times in the night. This is abnormal. A normal person is supposed to urinate once or at least twice per night. But from 4 times and above, it means there is a problem. And a symptom is an indication to you that inside your body, there's something wrong that is taking place. So if you go to that symptom of frequency in urination, more especially at night, why do we say at night? Because at night, it is believed that during the night, you don't drink, you don't eat, which is different from during the day, because during the day you are eating this, you are drinking this, so there are more chances of you passing urine frequently. But at night you are taking nothing but urinate those many times I've talked to you earlier. After seeing that frequency in urination, this enlarged prostate has got more symptoms. Then another symptom is we call it urine urgency. To urgency means that me, as I'm seated here, or you, as you are watching TV, you are doing anything of your choice. When I feel the urge to pass urine, this patient has to go there and then to empty the bladder. He cannot hold the urine. So once you fail to hold urine, the brakes are worn out. The brakes are now worn out. So, and you go to empty the bladder there and then. That is another symptom that affects the men, the elderly. And what does this mean? This means that you are not convene. You cannot meet with people. Why? Because you know your problem of releasing urine urgently. So once you have got that symptom, get to know that you are likely to have this enlarged prostate. Viewers, I need to remind you that this program is brought to you by Crest Natural Health Center, locally called Eduardo Yabakade, a hospital that is specialized in treating the elderly. Then another symptom is incomplete bladder emptying. Incomplete means you have not fully emptied your bladder. What does it mean? You feel the bladder is full, you go to empty the bladder, but you release urine in small quantities. Most of the urine has remained in the bladder. How do you get to know this? We get to know this once you come to the hospital during the investigations. Once you come here, we shall subject you to do a scan, an abdominal scan. So during that process of a scan, you are subjected to be given water to drink. So at the peak, when the bladder is full, that's when you shall be subjected for this scan. And the health worker will tell you to go, after finishing up the scan, will tell you to go and empty the bladder. And on coming back, he also puts you back on the scan, and you'll find there is what we call residual urine. Residual, the urine that is not emptied. Why? In our previous program, we looked at the prostate. We said that the prostate is below the bladder, and it is on the other side of the urethra. The urethra is that tube that transports urine from the bladder to the outside the body. So the urethra, the prostate is on either side of the urethra. So it started by strangling little by little, strangling it, and in the process you get that incomplete bladder emptying, not completing the bladder fully. So that is another symptom. Then another symptom is also affecting the elderly. We call it involuntary urination. The word involuntary means you don't decide on your own. That means that once you go, this senior citizen go to sleep, go to his bed. By the time he wakes up, he finds himself in a full, the mattress is full of urine. This means that you can no longer sleep with your woman. The house of this old citizen is full of smell. People, they don't want to associate with you. Why? They smell urine. So, if there is this symptom of involuntary urination, it is a sign that you have got prostate enlargement. Then another thing is that we call it dribbling of urine or intermittency. Intermittency or dribbling of urine, they almost mean the same. Dribbling means that you release urine in drops. Let me ask you, when will you finish up with this bladder, which is full of urine? Mind you, the bladder has got a capacity of 600 ml of urine. But tell me, when will you finish up with this to empty the bladder? When? So it is a sign. It is a sign that you are likely to get blockage of urine. So if you have got that symptom, please come to Hillcrest Natural Health Center. We are specialists in treating that disease without surgery. Then another stage, which is another symptom, which is going to be the last symptom. I, George Lutwama, speaking to you, I've got an experience of more than 10 years in this practice of treating men from morning to evening. And I've come to find out that if I've got 10 men suffering from prostate enlargement, nine of them will be having low manhood. They can no longer sexually perform better. Losing their libido has gone out. And this condition troubles men. They don't know what to do. And it is a common symptom. So, as we sum up, ladies and gentlemen, if you have got such symptoms, I request you to come to Hillcrest Natural Health Center at Rutete. We are specialists in treating that condition without surgery. You can come, book an appointment, or you can view. You can call us. On this video, there are phone numbers down there. You can give us a call for your comment, for your question, or to book an appointment. We are ready to serve you. We don't treat prostate enlargement alone, but we treat other conditions, namely the cardiac problem, that is the heart, the spine and joint problems, and many things. So at this point in time, I wish to end here, and we promise in the next program we shall be looking at what happens when you resist to respond to the symptom that your body has sent you. We are going to be looking at what happens if you resist to respond, to come to the hospital once you have failed to respond to those symptoms. So I wish to end here, and I need to thank you for viewing us. We are ready here. We are ready to give you help in terms of questions, in terms of answers, in terms of guidance, and in terms of treatment. So thank you, thank you, thank you.